The DPP-4 inhibitor is an agent in the class of incretin drugs. It's actually the inhibitor of an enzyme called dipeptidyl peptidase 4, which is responsible for breaking down endogenously secreted glucagon-like peptide 1 out of the intestinal L cell. It is administered orally and could be instituted at any phase in the management of type 2 diabetes, either as monotherapy in those patients who may not be able to take metformin for whatever reason, whether it be because of limited renal function or perhaps because of intolerance, versus combination therapy with metformin, and also could be available as a combination therapy with other orally administered medications as well. These agents tend to be more weight neutral and have a very, very low risk of a hypoglycemic event unless they're used in combination with medications that could increase that risk of hypoglycemia, such as the secretagogue class, or even in use in combination with insulin. The DPP-4 inhibitor tends to be a fairly neutral agent to add, and when you look at the head-to-head studies of the DPP-4 agents compared to the secretagogue agents, non-inferiority was actually conferred when looking at the efficacy of these two different classes of agents. So they tend to be a little bit friendlier to use, could be utilized at any stage of type 2 diabetes, and again, the risk of hypoglycemia could be averted by the use of these agents.
The mechanism of action of DPP-4 inhibitors is that it actually inhibits an enzyme called DPP. And by inhibiting this enzyme, what that allows is the increase in incretin hormone, specifically GLP and GIP. And what this in turn does is it stimulates insulin secretion and a decrease in glucagon, and the result there is a decrease in your blood sugars. There are a lot of benefits of using DPP-4 inhibitors. Some of them include it being an oral medication, and so in patients that are unwilling to potentially inject, it's a very good alternative to add on to metformin or other medications that the patient might already be on. Others include that it has a very low hypoglycemia risk profile. So my patient population, where I'm dealing with a geriatric population, that's something that's of importance to me. And so wherever you're worried about a patient becoming low, or if they're by themselves, it has a really low hypoglycemia risk profile. And then also compared to a lot of the older drugs, such as sulfonylureas and TZDs, where we've seen weight gain, these medications are weight neutral, and so a patient doesn't experience any additional weight gain. Would probably be the two biggest benefits and attractive features of this class. The 4 DPP-4 inhibitors that are currently on the market are sitagliptin, saxagliptin, alogliptin, and linagliptin. All of these medications are taken orally, and they're all dosed once daily. One note that's important from a pharmacist standpoint is that most of them come in multiple different strengths because of the renal dosing that's required with these medications. The one exception to that rule is linagliptin, which does not require renal dosing, and so for that reason it only comes in one strength.